Everyone wants high-quality healthcare. But how do we know when we have it? How do we know whether everyone is getting the best possible care? How do we know we're reaching our goals for healthy people and communities? Because this tells us it's a measure. It's not a hunch or an intuition. It's a tool that can gauge what works and what doesn't, so we can do more of what works. Measures are based on years of evidence and research, such as clinical trials and data analysis, as well as feedback from providers and patients. Measures are created by measure developers, who are experts from a variety of stakeholder groups. Measures are now used broadly by many in the quality community. Patients and their families rely on measures to help them make healthcare decisions. Through research, rating systems, and publicly reported information that relies on measures, patients and families can make more informed decisions about their care. The Centers for Medicare and Medicaid Services uses measures in Medicare and other public programs to improve health and lower costs across the U.S. health system. Healthcare providers use measures to improve the care they provide. Payers, such as private health insurance companies, Medicare or Medicaid, and purchasers, such as large employers, use measures to check on not just the cost, but the value of the care they pay for, so they can make smarter decisions. Researchers use measures to discover the most effective interventions. Medical suppliers, such as biopharmaceutical and device companies, use measures to make sure their products, medicines, and treatments are working well. Standard-setting organizations use measures to evaluate systems of care and accredit facilities. We all use measures differently, but for the same reason: to ensure that every patient is getting the highest quality care possible. The problem is that there are so many competing measures, it's hard to know which ones can really improve healthcare. That's where the National Quality Forum comes in. NQF is a nonprofit membership organization that brings everyone together to improve quality through measurement. By leveraging the expertise of more than 430 member organizations, NQF builds consensus on the best measures to use so we can achieve quality healthcare together. NQF helps us focus on measures that are scientifically sound and useful in the real world. When a measure is recommended by NQF's Measure Applications Partnership or endorsed by NQF, the quality community can be confident that it has support from experts across the healthcare sector. From there, the measure can be used by everyone to improve quality and reduce costs. And by pointing the way to better care, a measure can save lives and improve the quality of life for millions of people. Effective measures that make us healthier and happier. That's something everyone in the quality community wants to achieve. Learn more at NQF's website to see how membership can deepen your organization's understanding of quality and measurement.